Look and feel better while maintaining your ethnicity. Trust an Asian plastic surgery specialist who understands the Asian client and what you need. Hi, I'm Dr. Philip Young, and I'm an award-winning beauty theorist and facial plastic surgeon from Seattle, Bellevue, Washington, and we're Aesthetic Facial Body Plastic Surgery and the Beauty Docs on YouTube. Here I am in the operating room performing a procedure. I've been doing Asian plastic surgery for over 15 years and counting, and I have the unique understanding about the Asian client that is needed for Asian plastic surgery. I visited and observed other Asian surgeons in China, Vietnam, and Korea, and I continually research and study my field. This next 50-something Korean American patient wanted to replace her silicone implant with her natural tissues. Here she is after a revision rhinoplasty using ear cartilage and temporalis fascia to recreate her nasal bridge and tip. She had a great result and was so happy to have the artificial implant out and everything natural. You can have these same positive changes. Here's a 20-something Korean Asian patient before and after neck and lower face liposuction. She was super happy about not having a double chin and less marionette mouth lines. You can look and feel better just like this person. Now more on the Asian double eyelid procedure. We use a special technique called the orbicularis levator fixation technique, where the orbicularis muscle, as shown by the blue arrow here, is attached to the levator muscle, shown here. This unique approach creates more natural movement, more like someone born with a crease. The permanent sutures ensure a long-lasting result and has been proven safe and used for decades in this field. This is an example of the double eyelid crease forming procedure. This 20s Asian male from Seattle wanted to have bigger eyes and a higher crease, but didn't want the crease too high for a more natural Asian look. You can have great results just like this person. This 20-something Asian female from the Seattle area is shown before and after a double eyelid crease forming procedure and medial epicanthoplasty to also open up the eyes in the horizontal dimension. She had an amazing improvement in her aesthetics, and you can appreciate that immediately when you see her. This next patient is a 30-something Asian female from the greater Seattle area after an Asian double eyelid crease forming procedure. She didn't want to look tired anymore. You can get the same more refreshed and youthful appearance like she did. Here's another 20-something female after an Asian double eyelid crease formation and a medial epicanthoplasty. You can get that same boost in confidence like this person. Here's a close-up of the medial epicanthoplasty. Notice that there is very little evidence of scarring. Now more on the medial epicanthoplasty. This procedure opens up the epicanthal fold area and helps the eye look bigger in the horizontal dimension. Here the blue area is pointing at the pretarsal area and the small crease prior to surgery. Now the area is pointing at the epicanthal fold. The lacrimal is the fleshy area lateral to the epicanthal fold. After the epicanthoplasty, the fleshy area becomes more visible and the eye becomes bigger horizontally. These are the lines we draw on some of the incisions we do to keep the scars imperceptible while carrying out the procedure. Here's a close-up showing how the scars are imperceptible. You can have these same improvements in your look. Now we'll talk briefly about Asian rhinoplasty. Asians typically want to have a higher nasal bridge and a more projecting tip. The choice for alloplastic augmentation includes silicone and medpore for the bridge. You can choose to have your own tissues as well, and you can choose ear or rib cartilage. For the tip, we always advocate using your own tissues, including septal, ear, or rib cartilage. This next patient is a 50s Filipino Asian female professional after an Asian rhinoplasty. She was so happy to reduce her nasal hump and have her nose refined. You can too. This is a 50s Korean Asian female who had her silicone implant extrude out of her nasal tip. This is her before and after reconstruction with ear cartilage and muscle covering for a dorsal graft and for tip reconstruction. She was absolutely so relieved that she was able to get her nose back. Here's a 20-something Asian Chinese male after Asian rhinoplasty to remove a nose bump and for nose refinement. He felt more confident without the excessively prominent nasal bridge. This last patient is a 40s Filipino Asian female who wanted a more natural look with an Asian revision rhinoplasty. These were her images after removing her Gore-Tex tip and silicone bridge and creating a tip and bridge with her ear cartilage. She was so happy with her more natural look. You can also look natural without looking like you had something done. Thank you for watching. Call us so we can help you with Asian plastic surgery. We would love to have you subscribe to our YouTube channel. We're the Beauty Docs. We're going to be coming up with new, interesting videos showing you a glimpse into our lives in plastic surgery. Click the info button in the top right corner for links to learn about our theory on beauty that helps us get you the best results, to see a new video showing you a glimpse of plastic surgery in 60 seconds, to see me, Dr. Philip Young, talk about our practice in a more intimate setting, and to view our main introductory video for our practice. See you next time!